You have probably frequently heard that it is our recommendation for patients to lose weight before undergoing surgery. The task is not easy. However, in fact, in the present day, besides some standard advice to reduce portion size, increase physical activity, and other recommendations, there are actually quite specific medicinal preparations that allow individuals to achieve weight loss in a more effective and efficient manner. Today I would like to talk about the widespread use of popular drugs and the advancements in modern medications that have been made. These are agonists of glucagon-like peptide 1. In your day-to-day life and when visiting pharmacies, you can easily identify these medications under the brand names Saxenda and Ozempic. Saxenda is a liraglutide, Ozempic is a semaglutide. The history of this drug is initially related to the fact that it was invented for the treatment of diabetes. This is because glucagon-like peptide 1 has a wonderful property. It stimulates the pancreas to secrete insulin and increases the number of cells that can secrete insulin, thereby having a very beneficial effect on diabetes and improving the overall management of the condition. A medication, let's assume, has been developed which is essentially an enhancer of the secretion of this glucagon-like peptide 1 hormone. And thanks to it, a medication for the treatment of diabetes, known as liraglutide, has been introduced and is now available for patients who require it. Then it was converted into a medication used for the treatment of obesity. Why did this occur? It's observed that when using this medication, patients experience a sharp decrease in appetite. At times it can even be accompanied by nausea, occasionally even resulting in vomiting. Patients experience a significant decrease in appetite overall. This is linked to the fact that as it transpires, glucagon-like peptide 1, including one of its effects, slows down gastric peristalsis. That is, the stomach empties food less and accordingly it remains longer and this sensation of fullness arises. Furthermore, another dose of the drug liraglutide has recently surfaced with a specific aim of treating obesity, providing a targeted solution to this urgent health concern. For weight reduction, the medication was named Saxenda. It is sold in pharmacies. The peculiarity of this medication is that it is administered via injection into the abdomen, specifically in the area near the navel. It is given once daily without any approximation, but rather with exact precision. So, this medication is available in the form of a pen syringe, which is a special pen on which you insert a dose and inject yourself with a certain dose of this medication on a daily basis, so to speak, each and every day. So, this dose is gradually increased, starting with the minimum, then increasing. It's all detailed in the instructions, I won't dwell on it now. The second medication that emerged is already the second iteration of this drug, liraglutide. It is a formula comprising of 7 notes and is named Ozempic. It has been released for the treatment of diabetes. What is the major advantage of this medication? He stings on a weekly basis consistently in the same area near the navel, specifically targeting the stomach region without fail, every 7 days without exception. However, thanks to the weekly injection, patients find it easier to comply with and tolerate. The principle is approximately the same. The minimum dose begins, the dose increases gradually. Therefore, when we prescribe such medications to our patients, typically we advise them to concentrate on the effect. The effect is that the craving for food decreases, the desire to eat something decreases, the appetite decreases, and when you obtain such an effect, even at the minimum dosage, at this point you should cease and uphold the administration of such a dosage of the medication. Nowadays, these medications yield highly favorable outcomes. Thus, we extensively utilize them in order to ready the patient for bariatric surgery. Yes, patient? Administer this medication and within a span of 1 month, perhaps 2, it commences to effectively diminish body weight, and then we strengthen it with a bariatric procedure, thereby consolidating all these, so to speak, dietary habits, eating behavior, and other related factors. And the second point is that it can be utilized for patients, for instance, who have experienced an increase in weight following a surgical procedure. This can also be used. Another question is that you should know using such drugs is only possible after consulting a doctor. And you must comprehend that you cannot utilize them on your own under any circumstances, because this medication has an extremely high so-called safety profile. On one hand, it is quite safe, but it still has side effects that can result in very unpleasant complications in some patients. Hence, prior to using such medications, it is necessary to consult a doctor and do it under the supervision and guidance of a doctor. Therefore, in the present day, there is no need to despair, as there exist medications that are highly beneficial in aiding weight loss, and these medications can be utilized effectively in your professional practice. But I repeat once again, only after consulting a doctor. If you have any questions, write them in the comments. We will definitely answer them. Subscribe to our channel and see you next time. Thank you.